Grüezi ragazzi, bienvenue, and welcome to Cannabis Ciencias LinkedIn Live for today. The first one after a little bit of a summer break. We are super excited to kick these back off again, and we're super excited to be engaging with you guys again and to be welcoming amazing guests like our guest today. But before we get into that, a big thank you, first of all, to everybody that's tuning in live right now. Um, Big thank you to our guests also on behalf of the team and our audience today. If you want to comment and say thank you to Hannah, please feel free to do so. Please also let us know from where you're tuning in. We're always curious to know where our audience is currently sitting. Just a quick overview about Cannabis Ciencia and who we are. Our mission is to combat the bottlenecks to the medical cannabis industry, and we believe that these are concentrated in the education of healthcare professionals, which we need to increase access for patients in medical cannabis markets around the world. Um, we offer services to support the education of healthcare professionals, such as HCP seminars, medical marketing support for industry, professional training also for example, sales and marketing teams. You can also outsource your entire scientific research goals and objectives to us. And of course, because we are plugged into different markets across Europe, we can also offer our regulatory support and ensure that uh, regulation that is implemented is also scientifically sound. We also, earlier this year, launched our Principles of Clinical Cannabinology Handbook. This is essentially a guide for any healthcare professional that is interested in integrating medical cannabis into their business, whether you're a pharmacist or into their practice if you're a physician. And the book really intends to give its audience, uh, you know, all the necessary information that they need, starting with the endocannabinoid system and the therapeutic benefits of medical cannabis, as I think we have over 30 or plus minus 30 pathologies that we cover and how medical cannabis can be applied for them, as well as an overview of the different European medical cannabis markets. So if you're interested in checking that out or learning more about that, just scan the QR code on the screen and we'll be happy to answer any questions. But now, without further ado, please apologize my monologue. I'd like to welcome Miss Hannah Deacon. Thank you very much for finding the time today, Hannah. We really appreciate you, taking the time to speak with us today. We are fully aware that your schedule is super busy and you have some very exciting news around the corner, which you're going to be sharing with us today as well. But perhaps I can ask you to just give us and our audience a little bit of an intro about yourself.
Yeah, thank you so much for having me. I really appreciate you asking me to be on. So my name's Hannah Deacon. I started as a medical cannabis campaigner because of my son, Alfie. I always call myself an accidental campaigner. I didn't ever set out to say, right, I'm going to try and change the world for my child. But that's where I was because he was so seriously ill. I had to fight for him. And that culminated in us getting access to cannabis in Holland under prescription. And then managing to get her prescription for him. And so in my heart, I will always be a campaigner. I really care about fairness, and my son has an access to a prescribed cannabis product on the NHS, and I think that every person that needs access like that should have that access. So I work tirelessly to raise awareness around patients' needs who need prescriptions. I also work with Professor Mike Barnes and run a consultancy called Maple Tree Consultants. And that's because I really believe very strongly, and so does Professor Barnes, that doctors and patients should be absolutely part of the developing medical cannabis sector. And I also set up a group called MedCan Family Foundation with some colleagues of mine to help support families and carers and parents of children with epilepsy or cancer or autism who want to use cannabis. And finally, I also work with Dr. Leon Barron at the Medical Cannabis Clinician Society because, again, my passion is training doctors, because I think that if we train doctors, hopefully we'll see more access for patients.
So, first of all, thank you for everything that you do. It's people like you that I think inspire many of our colleagues in the industry. So I want to take this opportunity to just say thank you
Thank you.
for what you've the path that has been laid upon in front of you, the one that you've been taking. So, um, maybe we could start by you mentioned your fight that you've been fighting alongside Alfie, and I think the UK has a unique history in terms of the events that really sparked the development of this medical cannabis industry that we see today. Perhaps for any of our audience members that are not aware of how the UK medical cannabis kind of got its bearings, perhaps you could just touch on that a little bit for our audience.
Yeah, of course. So I think it's really important for me to be very sort of clear that, I ran a campaign that helped my son, but there were also other parents at the time running campaigns to help their children. And that's really important to note. Obviously, I can't comment on what other people did. I can only talk about what I did. And what I did is took my son to Holland, and spent 6 months there working with a paediatric neurologist. And he went from having 150 severe seizures within a cluster a week, which was needing high doses of intravenous steroids and other antiepileptics, causing him very severe side effects. I was a full-time carer. His life was, I remember saying to my sister once, you wouldn't put a dog through what he went through. And I really believe that. He was in so much pain and so upset and so affected by all the drugs he was given. And I too, as his mother, was tortured by what I watched him go through. And so we went to move to Holland, and that was the best thing I ever did. Once we did 6 months there and we proved that this medication worked, we were prescribed a high CBD, low THC oil, and he went from having those seizures every week to having 40 days with no seizures, which was a miracle for us. And we saw so much improvement in his cognitive development and his relationships and everything, his behaviour. So I came home in February 18 and started a high-profile media and parliamentary campaign. I ended up meeting the Prime Minister in March 18. The then Prime Minister was Theresa May. She allowed our doctors, and that's how I met Professor Mike Barnes. So he became Alfie's doctor, because unfortunately our NHS doctors were blocked from helping us, even though they were very supportive. He applied for that Schedule 1 licence to the Home Office because it was an illegal drug in the UK. And in June 18, we received that prescription, that funding. So Alfie has the first permanent medical cannabis prescription that was issued in June 18. And he's had that permanent prescription with funding ever since, so over 5 years. And he's actually over 3.5 years seizure free. So that's what inspires me to fight every day for other people, because I went from being someone who really struggled to function as a parent to being someone who has watched my son grow with joy and education and accessing friendships and all the wonderful things we've been able to do together in the last 3.5 years. And I believe that every carer like me in the country should be able to access that joy, to see their family, loved one, child be happy and enjoy their life. So that's how I was part of the campaign in the UK. And on the 1st of November 18, the law was changed, which allowed doctors on the specialist register to potentially prescribe if they felt that the evidence was there for them to do that. And I think it's really important to note that actually the UK legislation is very broad and actually very flexible. It allows doctors on the specialist register to prescribe within the NHS or a private setting for any condition, if they believe that there is evidence to back that up. So it's not that they can only prescribe for certain conditions, and they can prescribe for anything, but they just, at the moment, sadly, within the NHS, choose not to. And that's around funding, lack of education, fear of cannabis. And so we are seeing a sort of ballooning, let's say, private sector, sadly, but nothing publicly funded at the moment, other than Alfie's and a few other prescriptions.
That's really incredible when you say 3 years seizure free. I mean, that is a really inspiring transition that you've just described there. That's incredible. There are a couple of things that I would like to ask you about that you mentioned a moment ago, but the first thing I guess I would like to ask is how has this translated to or how have you observed this being translated to broader access for children that could benefit from cannabinoid medicines. Like, have you seen that there's been, more and more children being prescribed also? Like, has the pediatric care really developed since your campaign and since 2018, or has it kind of stagnated a little bit?
Yeah, I mean, it's definitely stagnated. I think that's really true to say, and it's very sad. I think there's a very clear line between paediatric care and adults. If we just quickly look at adults, within the private sector, there's now over 30,000 patients. I think it's growing about 1,000 patients every month. There are over 31 or 31 clinics now, 18 pharmacies offering a private service. So privately, I think there is a really good medical cannabis sector, and that is accessible by adults. It's not right. People shouldn't have to pay for it, but it's a start. And I think actually creating a private sector, which eventually possibly the NHS could refer out to, which would be a model that is used with other specialisms in the UK. It's great to see that developing UK sector, and that's why it's so important. When it comes to children, unfortunately, there has been very negative guidance from medical bodies for paediatric neurologists saying that there should not be any unlicensed cannabinoid medicines being prescribed privately or in the NHS. Only a product called Epidiolex, which is a CBD-only product, should be prescribed when available. So, i.e., only in the two conditions it's licensed for, which is LGS and Dravet syndrome. What we have to remember is a lot of children with severe refractory epilepsy have very rare conditions, sometimes undiagnosed. There's no trials in their conditions because, let's face it, there's not enough children to do trials. So my son is one of 9 boys in the world. There's never going to be pharmaceutical development of drugs in his condition for him, because boys actually are affected differently as girls for his condition, which is a condition called PCDH19. So it's really challenging for children. There were some prescribers in the private sector, but I'm afraid they've been shut down through this big pressure from this sort of membership group to shut it down, unfortunately. So actually what we see through MedCan Family Foundation, which I, as I said, help run, is we see families going to the illegal market. So more and more parents who are desperate for their children to survive, not to live in pain, not to have very poor quality of life. They've tried all the drugs, they've tried the ketogenic diet, they've tried the VNS. They're actually going to the illegal market to procure cannabis oil from people who make it illegally, which I don't think can ever be right. It means they can't talk to their doctors about it. They don't know what they're giving their children. They don't know if it's been tested, all of those things. And obviously it's illegal. So they're putting the risk of their own liberty and also the risk of having their children with them. And I think it's very scary to be putting families like that into that position. So that's why, I do continue to campaign on the rights of children to access prescriptions, because it actually is really, really important. And having sort of this current legislation and the current position at the moment really doesn't help children, which is a shame, because actually children changed the law in the UK. If it wasn't for the campaigns that were run by parents of children, there would be no UK cannabis industry. And I think that's what's really been forgotten sometimes.
Absolutely. So thank you to those children for putting up with that, but thank you to the mothers also for taking on that fight. There are you mentioned Epidiolex a moment ago, which is just one of a very, very small number of actually market authorized cannabinoid medicines. And you also mentioned research, which is obviously a crucial component of getting market authorization for a drug and doing finished drug development. What is the state of medical cannabis research in the UK at the moment?
Well, again, I think that's for adults, it's positive. We see Celadon working with LVL Clinic, starting a pain trial, which is great news. We've already seen Drug Science, who have hosted the Project 2021 data collection observational trial for the last 4 or 5 years, which has been fantastic. They've got a lot of data from that. And also Ananda Developments have secured funding for trials in endometriosis and pain. So there is some really good research happening. I think it's been very challenging for companies to secure that NHS funding, but it's happening. I think, again, going back to children, it's really, really difficult to do randomised controlled trials, which is basically what's needed for market authorisation. Very difficult to do that, firstly, in a plant. RCTs are done in single compounds usually. But also with children, as I've said before, very rare conditions, sometimes undiagnosed, but also this need for sort of stability for licensed medicines is difficult because we're talking about a plant. And actually, Epidiolex has, we have feedback from a lot of our parents. Some it works very well for children, but some it does not. And again, we're not saying, Epidiolex should be available to all children with refractory epilepsy. But if it doesn't work, then it should be an unlicensed at the moment cannabinoid therapy should be allowed to be prescribed on the NHS. And let's face it, all the drugs that children are given, whether it be in the UK or many other countries, most of them have not had randomised controlled trials in children because it's not ethical, because you have a placebo. When you're talking about very seriously ill children with seizures, ethically giving a placebo, is that right? We have a lot of questions around whether pharmaceutical trials are the best way of drawing evidence, firstly in the cannabis plant, but also in children with severe conditions who actually haven't got 10 years to wait for trials to happen. Pharmaceutical companies aren't going to back them because there's not enough people that will benefit. So at the moment, we do have this real blockage in the UK where the government is saying, well, we want to see data. And actually, that's not going to happen. Unless it's in single compounds like Epidiolex, which again, as I say, has its place, but isn't as effective as the whole plant oils that children use privately or that Alfie uses. And we know that through seeing how the children react to these products.
Absolutely. I think like medical cannabis, of course, offers this unique situation where you have this non-authorized medication being used, and there's this abundance of real-world data and patient-reported outcomes. And I think the challenge becomes how do you process this data and present it in a way to help you kind of move the needle. So, but again, with children, it's obviously that there's a whole nother degree of complexity, of course, right? I wanted to ask you also, you mentioned some of the hurdles, let's say, or some of the reasons for reservation of NHS physicians to consider prescribing medical cannabis, lack of education maybe, or lack of funding, like you said. But how is it in the UK if you go if you go visit your physician and you speak about this topic of medical cannabis? Is it also like I split my time between Canada and Germany, for instance. In Canada, it's very different to Germany when speaking to your physician about cannabis, of course. In Germany, it's still, it can be still quite stigmatized. Like, how is it in general with, in dealing with the physicians from the NHS? Like, are they also quite opinionated on the subject, or are they kind of intrigued by it and are open? Like, how have you observed most of the physicians kind of being positioned on this topic?
I think I've been very lucky personally. Alfie's doctors have been incredibly supportive, and my paediatric neurologist, NHS doctor, said Alfie's got the worst epilepsy he's ever seen. So he, of course, wanted him to be well as possible. And my GP, who prescribes under direction from him, is very, very supportive because he's seen the way Alfie has got better. I think it really depends on the doctor. Some doctors are ignorant of this, with no, all due respect to them, but they don't get trained in the endocannabinoid system. They don't get trained how to prescribe botanical extracts. They get trained how to prescribe pharmaceuticals. So they just don't understand it. And families are reporting to us that either doctors just say, we don't understand it and we can't engage with you. Some doctors are saying, well, you need to go private because I'm not getting involved with it. But actually, some doctors have really tried to get funding, have really tried to prescribe for some of the children that I know and the parents I know. They've really worked hard with their doctors to try and get that to happen. And unfortunately, these doctors have just been shut down. We do have, lots of layers of management within the NHS, and I think they're very fearful of litigation. Because it's an unlicensed special, doctors are taking full responsibility for that prescription, and they just don't want their doctors to take that responsibility, which I think is incredibly sad and actually misguided, because, as I've said, most of the drugs that children are prescribed, like benzodiazepines, steroids, chloral hydrate, things like that, which children are prescribed routinely who have seizures, are unlicensed and have no, they have long-term historical data, but actually we don't really know the long-term outcomes of giving children those sorts of drugs. But doctors accept at that point that we have to try because they're having seizures and they'll kill you. So I don't understand why cannabis can't be brought into that as a prescribable drug to help children stop having seizures. But so I think it's a very mixed bag, but a lot of it does come down to ignorance, but also very senior doctors who are ignorant, telling their colleagues how dangerous cannabis is, how it shouldn't be prescribed, how it's not being tested, how there's no evidence, which is just wrong, totally wrong. And that's, very challenging to cut through, actually, but people have to keep trying.
Absolutely. I think in this industry, in the medical cannabis industry, one of the key differences to the traditional pharmaceutical industry is that the onus of education really lies on us as an industry. Many physicians aren't even learning about the endocannabinoid system in medical school, or they're starting their careers and their practice completely naive to the subject matter, and then things like this can influence their opinions, of course. Now, you mentioned this before, that there are a number of private clinics, and I know there are. I've seen it recently in news of new products being launched in the UK and stuff like that. I was wondering what your take is on the current model, and if there's maybe anything that these private clinics can do to also help support your work in pushing for greater access. So. What do you think of this infrastructure right now? Do you see it helping many people? And what would you like to see from these private clinics to kind of help push broader access, and not maybe just focus on commercial, factors?
Yeah, I think the industry's been going now for 5 years, and initially, it was quite clunky, but I don't think that's necessarily clinics' fault or importers' fault. We have to import all products into the UK at the moment. We have 7 UK cultivators, but none of them are producing product yet, hopefully by the end of this year. So that's been difficult because the supply chain has been a massive challenge. But also there has been issues, i.e. the fact that the doctor, when he writes a prescription, or he or she writes a prescription, that prescription has to go to the pharmacy, the top copy. So nothing online. You can't. You can email the prescription and say, "Can you get this order ready?" But that pharmacist cannot dispense that product without that prescription in hand. Initially, at the beginning of the sector, there was lots of problems with people posting prescriptions, them getting lost, and some, I heard some patients waiting weeks for their first prescription, and then by the time they got it, they'd need to get a new prescription. So there has been a lot of challenges, but I do think that the industry is starting to listen more to patients and trying to provide a better service. The one thing I do think is a challenge is within healthcare per se, is actually the lack of acknowledgement of the importance of the people that interact with patients, because we do see a lot of people that initially weren't necessarily fully trained, I think probably not paid enough, not incentivized enough, and actually engaging with patients with not a full amount of education around what's available, how the process works, all those sorts of things. And actually with healthcare, whether you're a cannabis clinic or not, the impression for the patient and actually for the stakeholder is that impression of that engagement with that person that answers the phone or replies to emails. And I think that's getting much better. Initially, that was not given enough credibility. So I think the private industry is better than it has been and is going in the right direction. With regard to children, I think the problem is, as you've alluded to, this is a commercial industry and people are looking to make money, otherwise they're not viable, and they're looking to keep their shareholders happy. And that's really important for a viable business. But also when it comes to children, it's about engaging with me, engaging with MedCan, and talking about how we can work together to help people. And there has been a couple of companies actually that have done that and are trying to provide training to pediatric doctors, trying to get people to prescribe, trying to support us with importing products. So I'm very grateful to those people within the industry who have engaged with us and tried to help, because that's really important. And the Medical Cannabis Clinician Society, along with Dr. Evan Lewis, who sits on our committee, are working really hard to open up access for children. So there is a lot of good people in the industry that want to see this, but I also think the problem is that it doesn't affect enough people. And a lot of clinics, as you've said, they'll chase the pain patients, they'll chase the psychiatry patients, they'll chase the adult patients, because that's where the commercial benefit is. And that's why, again, I think it's really important that we do get NHS access, because then it's going to be more about the right people being referred to care, rather than it's always being that demographic being chased on a commercial level.
Absolutely. I want to take this point, this moment, actually, to just give a shout out to everybody that's involved in the prescription process and the therapy with patients. We actually had a session not too long ago on the role of nurses in cannabis therapy with patients, and we actually also had a nurse from the UK, Miss Sophie Hayes, on to kind of give us her opinion exactly. And we also had our friend Soraya Tomas out of Portugal also. And also have to give a shout out to my fellow Torontonian, Evan Lewis. He is doing a lot of
fantastic
work. Yeah, he's awesome. So anybody listening, check out Evan Lewis, Sophie Hayes, and
Sophie's on the committee for the society as well. So we surround ourselves by the good people.
Exactly. The good people network, as my friend Heidi Whitman would say, the good people network.
Oh, I love her. I know Heidi very well as well.
See? The good people network.
Yeah, definitely.
But on that note, Hannah, I would love to give you the floor one more time, and just give you the opportunity to kind of share with our audience what kind of activities you're up to keep the needle moving, and to keep the topic on the top of the agenda of those that need to be consistently reminded. And also, you have this exciting news today. So maybe you could also
we've got a documentary, or I'm part of a documentary which is coming out on BBC iPlayer from tomorrow, or midnight tonight, so Wednesday. And I'm going to be doing some media interviews in the UK around that documentary. So I'm really, really proud to be part of that, alongside 2 other adult patients who are talking about how cannabis has improved their lives. Also, on that documentary, there's some doctors being interviewed as well, and a grower in Portugal. So that's hopefully going to be a really good documentary, and I hope people can watch it and share it with their friends, because again, it's about building awareness in the public in the UK, because there was a recent survey done, and actually I think it's around 80% of people still don't know medical cannabis is legal to prescribe in the UK 5 years on. So we really need to do a lot around public awareness. I'm continuing to work with the Medical Cannabis Clinician Society. We're the secretariat, along with VoltFAS, for the APPG, which is an all-party parliamentary group on medical cannabis on prescription. So we've got lots of plans to work with them to help build hopefully more pressure on the government to do better when it comes to access for patients. So I'm really excited to be working with parliamentarians on that project, and also continuing to raise media interest, hopefully lobby MPs, have meetings a lot with MPs to try and get them to support this issue. So continue to do that, but very much so as well, focused on developing Maple Tree with Professor Mike Barnes, working with clients within the UK space, international companies that want to work within the UK space as well, providing strategic oversight, network development, lots of other services. So we're doing that as well. We're very, very busy doing all we can to support patients, doctors, and the developing UK sector.
Awesome. So we will definitely be speaking offline to see how we can join forces and make some magic happen. And I just want to take this opportunity here to thank everybody that tuned in today. It was super exciting to be back after a little bit of a summer hiatus. I also hope that everybody had a lovely summer, by the way, and everybody's gearing up for the fall. And just one more time, a big thank you to you also, Hannah, and
Thank you for
appreciate you
asking
taking the
me.
time on this busy
Been good.
day. Yeah. And I feel like we need to do another session soon, and hopefully we will have some updates to report on in the UK. Hopefully some legislative and access changes. But yeah, big thank you, and speak to you very soon.
Thank
Ciao.
you so much. Thank you. Bye-bye.